Today, in February 2024, the most exciting part of the use of CAR T cells in multiple myeloma is about using them in earlier lines of therapy. And this is about moving CAR T cells from the relapse refractory setting into maybe first or second or even third relapse. And this would be enormous because it's a true shift in the way we envision the management of multiple myeloma. And this concept is further supported by two major randomized phase 3 trials that are already available, the KarMMa-3 and the CARTITUDE-4. The trials are slightly different in terms of inclusion criteria, but the key message is that when you randomize whether ide-cel in the KarMMa-3 trial or whether cilta-cel in the CARTITUDE-4 trial against a so-called standard of care at time of relapse, the results in terms of PFS, progression-free survival, are significantly better for the CAR T cell. And that is likely going to allow the approval and the wider use of CAR T cells in the earlier course of the disease. And I believe in the next 3-4 years, we will see a dramatic change in the treatment algorithm for relapse refractory multiple myeloma. Having said this, I'd like to emphasize that when we look, for instance, whether in the KarMMa-3 trial or in the CARTITUDE-4 trial, if you look to the curves, in the beginning, there is a sort of a disadvantage for the CAR T cells because there is this issue of bridging to CAR T cells. So that brings me to the fact that CAR T cells are extremely useful and beneficial as long as we are able to provide an effective bridging rapidly for those patients who have a rapidly progressive disease. So you can see I'm very excited about moving CAR T cells into earlier lines of therapy, earlier lines of relapse, and this would be a huge benefit in terms of quality of life for the patient because they will enjoy a treatment-free interval. But we have to try to find solutions for those patients who maybe cannot wait until we get the manufacturing of the CAR T cells. But I believe this will be easier in the near future because we have now more effective bridging therapies, especially, for instance, bispecific antibodies, which were not actually available or allowed when these randomized trials were designed. So overall, I'm very optimistic about CAR T cells making it into earlier relapse.